Bismillah ar-Rahman ar-Rahim. Transient osteoporosis of the hip. Transient osteoporosis of the hip, also known as transient bone marrow edema syndrome of the hip, is a self-limiting clinical entity of unknown cause. Transient osteoporosis of the hip tends to affect middle-aged men 40 to 55 years old with male to female ratio of 3:1. When women are affected, it is usually during the third trimester of pregnancy. Generally, only one hip is affected at a time. Recurrence in the same hip is possible. Clinical presentation. Typically, patients present with spontaneous onset of hip pain, usually progressive over several weeks. In some instances, patient can go on to develop similar changes in the opposite hip or in other joints. Such cases should be referred to as regional migratory osteoporosis. Radiographic features. MRI is the modality of choice for detection of transient osteoporosis of the hip and demonstrates bone marrow edema pattern involving the femoral head, neck, and even intertrochanteric region without findings of osteonecrosis. Subchondral fracture lines can be found in almost half of cases. Sparing of the medial femoral head by bone marrow edema can be found in almost 90% of patients and disappears toward the later stages of the disease. Signal characteristics. On T1 MRI coronal image, it shows decreased signal with loss of normal fatty marrow signal, image 2. It is worth having a coronal of both hips so that one can compare the distribution of fatty marrow signal. On T2 coronal image, it shows high signal, often heterogeneous and may be striking, image 1. On nuclear medicine, typically, bone scintigraphy demonstrates markedly increased homogeneous uptake in the femoral head, a finding which is seen well before osteopenia is seen on plain films. Bone scintigraphy is not the modality of choice for evaluation of this patient, image 3. Differential diagnosis of T1 hypointense lesion in the femoral head. First, look to T1 coronal image if the lesion is present or not. If hypointense lesion is not present, so by 99% this femoral head is free with no pathology, image 1. If present, go to T2 coronal image to look if the lesion is still hypointense or not. If still hypointense, your diagnosis is red bone marrow, image 2. But if the lesion on T2 images is hyperintense, so it will be bone marrow edema, giving diagnosis of migratory osteoporosis, which will heal spontaneously or after receiving treatment within few months, image 3. After healing of bone marrow edema, we have two possibilities. The first one is complete healing of the disease, or a line appears in the femoral head giving possibilities of one of the following: avascular necrosis or subchondral fractures. To differentiate, do bone scan. If the lesion gives photopenic area, as in images 4, 5, and 7, this will be avascular necrosis. But if it gives hot area, as in images 6 and 8, it will be subchondral fracture. Finally, differential diagnosis between avascular necrosis, subchondral fracture, and red bone marrow. In case of avascular necrosis, could be unilateral or bilateral, and on T1 image it shows geographic line forming mirror image with cortical margin. Figure 11. Figure 9. While in subchondral fracture usually condition is unilateral, and on T1 it will shows a parallel line with cortical margin, as in this image, image 10. This is a parallel line to the cortical margin. Red bone marrow, which is usually bilateral, it will shows hypointensity on both T1 and T2 images. And this is the T1 image, hypointensity of the head and neck, and on T2 austere images still hypointense. Thank you.